I am really pleased to be here today. I'm Leslyn Keith. I'm an occupational therapist, and I specialize in the treatment of lymphatic disorders. And it's been my hope for the last several years to bring the information about lymphatics to the keto community. And also at the same time, I'm trying to bring keto to the lymphatics community because they don't have that understanding. So I'm going to give you some more background information on lymphatic disorders, which I normally wouldn't do at a lymphedema conference. But at a lymphedema conference, I have to give a whole bunch of background on keto, which you guys don't need. So my disclosures that I have a book that just recently came out about lymphatic disorders and using keto. I have a program that I developed for lymphedema therapists to use to help guide their patients to adopt keto. And I have samples of that stuff over here for you to look at later. So I have that financial thing. So this is what I'm going to talk about today. So why is the lymphatic system so important? Because we don't talk about it. People don't even know what it is. You don't know you have one until it goes wrong. And so we'll talk about that and how nutrition affects the lymphatics. And it's not what the lymphatic community thinks it is, because they are really stuck on the low-fat, plant-based diets. And I'll talk about my research that I did with obesity and lymphedema, and then also how I suggest doing keto for lymphatic disorders. So if you don't have a lymphatic disorder yourself, you're not even thinking about your own lymphatic system, I just wanted to draw your attention to where you might notice it in yourself. And so when you get a cold, you might, and your doctor always tests you right here, he's feeling for those swollen lymph nodes. So that's your lymphatic system, your nodes that are engaged because you are ill. Some of you might look like this at the end of the day. Some might look like that when you were pregnant. So it's very common to get that lower extremity swelling, that puffiness. And then some people, they notice when they go out for even just a vigorous walk or for a jog, their hands swell. That is your lymphatic system. So I just plugged this in here because a cool thing showed up on Keto Science, a Reddit group, and brought in the lymphatics to cardiovascular health. How many of you are familiar with this Sabatine article, a new theory about how plaque develops in blood vessels? He was talking about how it is not necessarily, his new theory is it's not that we're getting cholesterol gets into the endothelium from inside the vessel. It's actually coming from the outside, from the vasa vasorum, that's the blood vessel that feeds the blood vessel. So he's saying it's coming in from the outside because he says that particles any larger than 6 nanometers can't pass through that endothelium. And all the lipoproteins are 20 nanometers or larger. So he's saying it comes from the vasa vasorum. Interestingly, the way you get rid of HDL, the way that is removed is through the lymphatics. And so someone on this Keto Reddit group said, well, if we have poor lymphatic drainage, if we're not getting drainage away from the area, we're going to get a buildup of plaque. And when you have a coronary bypass, you have this new vessel that's put into your heart to bypass around the blockage. Your body has to make a new vasa vasorum to feed that blood vessel. Well, sometimes it doesn't make a lymphatic system to drain away from there. And so could that be causing a problem? Another place where our lymphatics are involved in everything that we do. I'm thinking about everything that's been presented at this conference so far. Cancer, lymphatics are involved, right? Metastases through the lymphatic system. All the things that our lymphatics are involved. So this is important to everybody, not just people who have a lymphatic disorder. So when was it discovered? We really visualized it when They did a dissection of a dog after a meal, and because your lymphatics evacuate the dietary fat, they remove it from the intestines and move it along to where it's needed, it becomes milky white instead of just clear. And so they easily could visualize it when the dog was dissected after a fatty meal. So they started realizing this is another one of those humors that are out there, another fluid in the body. So a lot of parts of the lymphatic system, it's very extensive, it's everywhere. We have those lymph nodes, those are your lymphocytes are in there being stored. It is a kind of a filtration station. So, you know, when you have some kind of cancer and they take out nodes, they're checking to see if any cancer is in those lymph nodes. Lymph vessels, everything from the smallest capillary all the way up to the larger trunks, the thoracic duct, that main one that goes right through your trunk. And then we know we have lymphatics in the brain, the lymphatics. So, and that is, I saw a great video by Dr. Perlmutter talking about how sleep is so important, because when we sleep, we have a little bit of shrinkage of the brain, and it allows better drainage by our lymphatics to clear out the junk when we sleep. So now we know it's very important to have good sleep in order to allow that drainage. Maybe that has a big impact on dementias and Alzheimer's and stuff if we're not getting that good clearance at night. And then the lacteals, which we're going to talk a lot about in here, because those are the specialized lymphatic vessels that are transporting dietary fat from the intestines to the bloodstream. And then we have several organs involved in the lymphatic system. So spleen, thymus, Peyer's patches, this great grouping of it's an organ in your intestines to monitor all the stuff that's coming from the outside world and making sure it's safe, and your tonsils. So back in 1898, Starling figured out or he had this theory about fluid balance and how this worked in our body. We've been operating pretty much for the last over 100 years on his theory, which has never been proven. Luckily, it's been updated. But what he decided was that 90% of the fluid, after it was put into the interstitium, it was reabsorbed into the veins and transported back to the heart, cleaned up and stuff. And the lymphatic system just took care of about 10%. Whatever couldn't fit in there, and the bigger particles and the other waste, lymphatic system transported. So interesting, Levick and Michelle did some more research and put together a nice paper in 2010 where they talked about actually very little goes back into the vein. Your lymphatic system evacuates just about everything from the interstitium. So this is a very, very important system that has been virtually ignored. So the jobs of the lymphatic system, and they're all equally important, but the first one is immunity that we'll talk about. The lymphatic system is your immune system. We got to keep a healthy lymphatic system for us to stay healthy. And then fluid balance, when we're seeing that swelling happening, we're having a problem in fluid balance. So either there's been a blockage or a disruption to the lymphatic system, or it's simply overwhelmed and it's not able to keep that balance in check and avoid edema. And then transport of dietary fat. So those lacteals are picking up short chain and long chain fatty acids from the intestines and transporting that to the blood. The medium chain triglycerides go directly to the liver to be used for a fast form of energy right away. So let's look at a couple of disorders. So anybody familiar with lymphedema in here? Yeah, okay, quite a few of you, good. It used to be an unheard of word, right? Lymphedema is an accumulation of that protein-rich fluid trapped in a limb, and what they added on to the definition in the last 10, 15 years is that you develop this reactive fibrosis and tissue inflammation. They get a high incidence of infection in that condition. And it could be primary or hereditary lymphedema, where you're born with an imperfection lymphatic system that could show up at birth or puberty or pregnancy or other times in life, could be even later after menopause. But you also could, I think a lot of us are familiar with like the breast cancer related or any cancer related lymphedema where you've had lymph nodes removed or you've had radiation therapy or some other disruption to the lymphatic system because of your cancer treatment. That's one of the more common reasons for lymphedema in the US. I've seen swelling, lymphedema everywhere in the body, except for nose and ears. There's a couple lymphedema therapists in here. Have you guys seen it in the nose or the ears? You have, okay. So you can get it anywhere in your body because you have lymphatics everywhere in your body. But
leg on the left got lymphedema as well?
it's highly possible that they could, and it also could be that they have venous insufficiency over there. So the veins are not working so good, and there's simply a excess of fluid that's not being evacuated, which there are some lymphatic physicians who say anytime the lymphatic system is overwhelmed, that's lymphedema. But others will say it's only lymphedema if the lymphatic system has been impaired. But that's good eye, yes. And if you couldn't hear that on the recording, she asked if the photo was if the other leg was also swollen as well as the very obvious one leg that is quite swollen. So a lipedema is another lymphatic disorder, although this is, there's always areas of contention in your community with your colleagues, and so some are saying that lipedema is not a lymphatic disorder, but there is definitely a swelling component. Lipid is fat, and edema is swelling, because there definitely usually is some water component to lipedema. But this is a fat disorder. We have that abnormal deposition of fat from basically the waist to the ankles. The feet are not involved until they start to get swelling in their feet. And sometimes it's the upper arms, but quite often and it's pretty much exclusively women, and this woman could look like two different people. A different size on the top and a different size on the bottom. This is showing you the 4 stages. That's not all the same person, but just showing you the mild to the severe and what could happen with lipedema. Unfortunately, accompanying that, the lack of mobility and a lot of times the knee issues is that there's quite a bit of pain, a lot of extreme hypersensitivity and tenderness to the legs and the areas where the fat is. And we've always thought that it was completely non-responsive to diet and exercise until we started doing keto, of course. So I want to just talk to you a little bit about this really interesting interrelationship between adipose tissue and the lymphatics. In the lymphatic community, there's always been, I'll say in the last 40, 50 years, some disdain for adipose tissue. And, how can we get rid of it all? We need fat, right? We got to have some fat on our body. And we specifically need it to help the lymphatic system. So there's always been this really close proximity. Wherever there are lymphatics, there's fat. And so it was postulated by Natasha Harvey and others, researchers in Australia, that it actually is because the lymphatic system needed it to power the immune response. So for instance, when you have lymph nodes in your armpit, they're trying to harvest those because you've had breast cancer and they want to excise a couple of nodes. They don't know how many nodes you have in there because they're all buried in the fat. So they're going to where they light up blue and they're removing those, but they don't know how many nodes are there. Because they're all in that bed of fat, it needs that fat to power the immune response. And of course, the highest concentration of lymph nodes in our body is in the abdominal cavity, and we have that nice layer of fat there that is going to supply that. And now with the recent advent of lymphedema surgeries where they're doing lymph node transplants, they like to remove it from the omentum because it comes with this nice little power source. You take it with the fat. And then, of course, the superficial lymphatics right underneath your skin, those are in your nice subcutaneous fat tissue. So, and that's, I went to a conference where a well-known physician talking about lymphedema was saying that, look at all this fat around those lymphatic tissues, our subcutaneous fat. We can't get rid of that. I don't want to get rid of that. We need that. That's good stuff.
Sounds like the doctor not understanding the need for the lymphatic system too.
Of fat. And this is what we're trying to do. We want to bring that information of how important fat is to our lymphatic system. Yes?
Does liposuction interfere with the lymphatic drainage?
So I'm just going to repeat that question because you're not at the microphone. And she's asking about, does liposuction interfere with lymphatic drainage? Absolutely. But we're able to, as we'll talk about further, especially if you're eating keto, you can regenerate some of those superficial lymphatics, those pathways to help with that. There are, especially in the case of lipedema, they're now doing some liposuction on the very extreme cases to reduce the pain and the size of the limb. By doing liposuction, quite often they're going to have a lot of post-surgical swelling and issues with fluid balance. But I think if they were to do keto post-surgically, that would definitely be in a better place. But that would be an issue. I want to share with you some research that's been out there. And unfortunately, it's mostly animal research, mice and rats. So I will show you a little bit of what's out there. So there is, this is again Natasha Harvey and her group in Australia. And what she found that when you have an acute inflammation or acute infection, we have lipolysis. It draws on that fat to give it power and breaks down the fat. But what happens when we have a chronic inflammation? It's, lymphedema sits there with that swelling for years. And then it decides, I need more fat because it's obviously a chronic problem. And so what happens is, this is a cross-section of someone with breast cancer-related lymphedema in the one arm and her other arm. And in comparison, you can see how much fat proliferated in that limb. So then as we try to treat that limb, we do everything we can to remove the fluid, but it's mostly fat in there. But interestingly, and this is only anecdotally, you go on a keto diet and we know that it burns fat in your body in generally, and what we're finding is that also we get a reduction in that limb size even though there's no fluid there. So I know that it's burning the fat in the limb as well, but we can address that. You cannot address that with a standard American diet. You are not going to do anything for that fat in that limb at that point. This one was also on mice. Came out in 2017, and unfortunately is only on mice, but it really was bolstering my argument that we really need fat in order to have the lymphatic system be healthy. And so they did the study on mice, and they found that fatty acid oxidation really controlled what happened with the lymphatics. If we didn't have enough fat, then the lymphatics died off. And when we had enough fat, we were actually able to make new pathways, even though there was, you might have done something to obliterate the pathways, such as like radiation therapy or something like that. And then acetate supplementation, they could recover some lymphangiogenicis. So you can see right here, the baseline is that control was the first photo. And then they used, and I don't know if I'm going to pronounce this right. It is no. This is etovomir or something like that. It's a drug that actually prevents fatty acid oxidation. So you can see what happened to the lymphatics. First, they actually burned it like it was radiated. And then they took that, they gave them that drug that prevented the fatty acid oxidation, and so then the lymphatics died off. And then you gave them some acetate, and they regenerated. Okay? So the red in there, that's blood vessels, and the green is lymphatic vessels. And then when they used that drug and the acetate together, you can see that the acetate was able to overcome a little bit, and you have pretty good regeneration of those vessels, but not as good as when we just did just the acetate. So, they theorized that, wow, this might, fatty acid supplementation, otherwise known as a ketogenic diet, might be useful in treatment of lymphedema. So this was a case study on a person who had a very rare condition, chylothorax. So this person had, chyle is that milky fluid that comes out of your intestine and into the lacteals, the intestinal lymphatics. And so they had a leak, and so the chyle was leaking into their trunk. And so typically what has been suggested for that person is, well, that those lymphatics are being used to transport fat, so let's have them use a low-fat diet, and then there will be less of a burden on those lymphatics. And since the MCTs bypass the lymphatics, well, we'll give them MCTs so they can have some fat, and let's see what happens. And so on this one case study, the person still continued to leak, didn't do well, but they did, in sequence, they did a low-fat diet. Okay, then let's try MCT only, and let's try just, the feeding goes right into the vein. And so, interestingly, MCTs are never found in the thoracic duct, in the lymphatic system. As soon as you took away all fat from this person, then all of a sudden 20% they had an increase of 20% of MCTs in the lymphatic system. So that tells me the lymphatic system really needs fat, and if you're going to deny it every other kind of fat, it's going to take MCT. And unfortunately, you can't get the person on this kind of a diet indefinitely, even if it was working to stop the leak, because they're going to still end up with a fatty acid deficiency. You can't live on MCTs alone. And because MCTs typically cause diarrhea, you end up losing any other kind of fats you're getting, you end up losing a lot of that. So it's not a safe way to eat to only be MCTs.
Excuse me, so what you're saying is that MCTs are okay as long as you eat other fats, or
yeah, you could.
Shouldn't do MCTs?
Yeah, no, you could. This is interesting because she was asking if it's okay to just have MCTs or if you need to have other fats along with MCTs. And I was just talking with Benjamin Bickman, and he believes that if you have an autoimmune disorder, MCTs may not be good for you at all. So this is worth looking into and discussing more because we're really into coconut oil, which is high in MCTs, which I think is probably very good for most people. It's also high in saturated fat. You know, we love coconut oil, but there's more to learn on that. But specifically, we're talking with this condition, since medium chain triglycerides avoid the lymphatics, typically are not transported by the lymphatics, they thought that this would take the burden off of impaired intestinal lymphatics by not giving them those. And when you only gave MCTs, it said, I got to have some fat. So it took something it normally wouldn't take because it had to have some fat. Yes. So, and that's just to show you, when they were on a low-fat diet, there was no MCTs found in the thoracic duct. And the next column, when were on MCT diet only, they were only given MCT, and then all of a sudden we have a bunch in the thoracic duct. And the last one with the vein going into being fed directly into your vein, I always forget what that's called. TPN, yeah, I use the initials TPN. Then there was no MCTs in the thoracic duct or the lymphatic system. So when they were limited to MCT only, then all of a sudden it went into the lymphatic system. This one again, 2 studies on mice, as most of them are. So the first one found, this was back in '87, found that dietary fat facilitated lymphatic transport. And later, Zoija and colleagues found that, oh, how interesting, fructose impaired lymphatic transport. So in the first study, the mice were given olive oil. I was talking to the olive oil vendor here, and I said, you know, you are really good for mice lymphatic systems. So not only do we have better transport, but the vessels were contracting more frequently, so the oil was good for that. And then the other, they were trying to induce metabolic syndrome, and what better way to induce metabolic syndrome in mice but to give them a high fructose diet. And then all of a sudden, we had reduced transport capacity. And you can see on the photo on the right, do you see how thickened and inflamed that area is? So you have less ability to transport fluid because the openings are smaller. And then two studies that came out in 2016 and 2017, both found that obesity affected lymphatic transport, but a high-fat diet did not. And this also bolstered my argument that I was trying to give to the lymphatic community, but unfortunately was only done on mice. But it does start to build that knowledge. So, and interesting, both these studies, they did a high-fat diet. It didn't mean they did low-carb. So this was interesting. Even with high fat and probably a lot of sugar, they still didn't have lymphatic dysfunction unless they were also those mice that tend to develop obesity with a high fat diet. There are some that are bred specifically to do that. And if they did, then that's when they had lymphatic dysfunction, when they were also obese. And if they had induced lymphedema, they usually do a thing with their tail, and they give them lymphedema in their tail. It didn't aggravate the swelling by having a high-fat diet. And again, a high-fat diet that was probably also high-carb. And they also saw increased macrophage infiltration, so we know we had good immune function going there. And then they also, with the high-fat diet group, tended to have larger vessels, so increased transport capacity. And in the conclusion of that study, interestingly, I thought this was interesting, still coming from that paradigm of, well, this can't be good to have high fat, right? They concluded that the high-fat diet didn't seem to harm the mice, but they didn't seem to even acknowledge any benefit that they have these larger vessels that had increased transport capacity. So let's look exactly how does obesity impact lymphatic disorders. And so just a couple of pictures here. This woman is obese, but that's not all fat on her legs, especially the lower legs. That's mostly fluid. That one I just got off the internet just to kind of see that, how the legs go. And this woman actually has lipedema. But there's a lot of, you can see in lipedema, usually the legs are totally symmetrical. I mean, you see one a little larger than the other. That is usually because there's fluid in that leg.
If those people have regular lymphatic massage, would that help to alleviate some of that fluid, or is that a persistent condition that cannot be
Overcome. So she's asking if a person with a lymphatic disorder has consistent lymphatic massage, can that help with that? Or is it something that's going to persist? And it definitely can help, but I'm here and I know you all agree that you have to have nutrition too. Because doing the specialized treatment will not be successful on its own. And I found, especially in my practice with my patients who are obese, intact lymphatic system, no cancer or anything like that, intact lymphatic system, we couldn't do anything about their swelling unless they also lost weight and had better nutrition. So yes, something can be done, but you have to have the whole program. So there has been some conjecture that we might just have a mechanical impingement. So when you have a very large belly, and particularly when you're sitting down and you get that pressure, that weight right onto these inguinal lymph nodes, basically the exit point for your legs to get out, the fluid to get out, if you have that pressure there all the time, you might be causing a mechanical impingement. I'm not so sure if that actually happens, but it could. And then in the presence of obesity, we know we have that imbalance in pro and anti-inflammatory adipokines. So we're going to have more inflammation, and so that's going to be then more swelling. And then you have leaky blood vessels. So you have that increased permeability, so you have the sometimes that darkish color on the lower legs because you have poor venous return. And of course, we get the leaky lymphatic vessels. Interestingly, one of those anti-inflammatory adipokines that gets suppressed in the presence of obesity, adiponectin, is vital for keeping our lymphatic system healthy, for keeping the integrity of our vessels. And so we get those leaky vessels, even more swelling in the lower legs. I had the opportunity to shadow Dr. Eric Westman at his clinic, and as he was seeing patients. And the first one, it just looked like they had swelling in their lower legs. And so I said, it seems like we've got something going on there. And so after every patient after that, he started just pressing his thumb right on the shin to see if it would pit because there's swelling. And every single one after that had swelling in their lower legs. Yes?
I have a question. My father had a severe, swollen legs.
If this is going to be long, can you step up to the microphone just to make sure we catch this?
I had several relatives with the lymphedema in their legs and stuff, and I was wondering, you're talking a lot about the impact of the internal functioning of the body and the infection and everything. Does that also make them susceptible to outside skin infections?
Oh, absolutely. Yeah. So, and there's a lot of stuff going on there because in your lymphatic system is your immune system, and it's overwhelmed at this point. Either it's impaired because of cancer treatment, or if it's overwhelmed because there's just too much fluid for it to evacuate. How can it then properly form its immune function? So that's the problem a lot with our lymphedema and our people with lymphatic disorders, is they do end up with a lot of infections. Yes.
Now, does this affect or have anything to do with varicose veins too? Is that interrelated, or does it make them worse? Or
yeah. So she's asking, is this interrelated to varicose veins or venous problems? Absolutely. And I would say that now, especially with the rise of obesity and diabetes, most of my patients coming to me with venous problems and not necessarily, with a cancer-related lymphedema. It's definitely, and then if you have it on both, right? You've had cancer treatment and you have a venous insufficiency, then yes, it would exacerbate it, make it worse. Typically with lymphedema, we're not getting a lot of wounds, but with venous disease, we do get wounds, and now you combine them together and you got all these infections and wounds. So it's not a pretty picture. Absolutely would exacerbate it, yes. So given that there's a lot of research on mice, I decided to do a study with people. And specifically, I pursued my doctorate just because I had gone to a lymphedema conference, and I was quite alarmed when a colleague presented me with a draft for a book that he was going to present about a diet for lymphedema and lipedema, and it was going to be a plant-based, high-carb diet. And I found that to be so distressing and so alarmed, I thought, okay, I have to do something. I can't just go write a book because who am I? So I need to have a doctor in front of my name. And so I actually pursued my doctorate in occupational therapy knowing that this is the research that I wanted to do. And luckily, my university allowed me to do that. It got through the IRB. Because, in the early 2000s, if you wanted to do a diet on humans that was high fat, it was hard to get that through. So I was able to do this, and so I had a lifestyle group of 12 people enrolled in that. They all had a BMI of at least 30. 10 finished the group, and it was 12 sessions and 6 individual sessions. And the first 7 sessions were all about diet, and the last 5 were all about other lifestyle issues and how to sustain change. And so this was published in American Lifestyle Medicine, Journal of American Lifestyle Medicine. And if you would like a copy of that, I'd be happy to email it to you. Destiny's going, send it to me. And you will have my email again at the end of this, and you can feel free to email me and I'll send you a copy of that. So here are the results. And everything was significant in all 10 of my outcome measures except for reduction in percent body fat. And that is only because not everybody in the group adopted the diet. We know that not everybody's going to do it. But even with that, because the results were so good with the people who did, it made the averages all come up. So quality of life, limb volume reduction, waist measure, weight, all that was significant. So looking at the 2 groups, the red line on the top is the group, the 4 people who did not adopt the diet. We did 3 weight measures prior to the intervention, just to show that it was stable baseline before we did the intervention. And then at the end of 3 months, we weighed again, and then 30 days later. And so they had an average weight loss of 1.36 pounds. And then the 6 people who did do the diet, again, very stable prior to the intervention, and then you can see after the intervention, and then again 30 days later, and lost 18 pounds or 8% of their body weight. Yes?
In your study or in your practice, have you observed gender-related differences?
So in my practice, if I observe gender-related differences, and so you will see that right here. Nope, in the next one. I'm going to show you that I only had 1 guy in the study. Most weight loss studies are mostly women, right? And so I only had 1 man, and you will see how he was different. Yeah. So, but this is showing just the weight. And I will show you, too, that you could see how the average weight of the people who didn't do the diet was much higher. That was because the 1 guy weighed 100 pounds more than everybody else, so he brought that average up. So that was also another difference. But here you can see blue ketogenic diet users, and they lost, 3 of them lost over 20 pounds, and then not so much on the non-ketogenic diet users. So here you see that 1 red line. He lost a whole bunch of limb volume, and he didn't lose hardly any weight. Don't know why. And by and large, it was much greater limb volume reduction in the people who used the diet. So I'm just going to do 2 case studies for you really quick, because I know I'm running short of time. But these are really interesting. And the first one, you can see, this is Kelly. He was planning on being here today, so he wanted me to use his full name. He was not a patient of mine, but we communicated by Skype and email and stuff a lot during his journey. And he was 51 years old. Well, he is 51 now, and he had a military career, and he was a triathlete. And they decided that he had reflux, and so they injected him with this polymer that was supposed to go into the esophagus. It didn't. It went into his thoracic duct. And so then it permeated his body. And so this is what he looked like. And they said, oh, you're obese. Exercise more. Eat less. Okay? But he had horrendous symptoms. He had tremendous weight gain, swelling to almost everywhere on his body, including the right side of his face, which is interesting because it should have been the left side by just how your lymphatic system is. But he had tremendous difficulty breathing. He had to go on oxygen at night. He had ended up using a CPAP. He had severe pain, a lot of GI issues. And he actually even thought about suicide because he was doing so awful. This happened in 2005. He is managing at this point, but he went through a long time before he even figured out the ketogenic diet on his own. So he was having a really rough time for all that time, and then had a medical discharge. So they told him, do a low-fat, low-calorie diet and exercise. Finally, they did some imaging, and you can see right there, that's a big chunk of plastic that's right there. But it's throughout his torso, affecting all the organs. So, and his background is engineering, so he kept a lot of data. So this is, he doesn't have the recent stuff for me, but at least he has through the middle part of 2017. You can see almost at the far end of that graph, at that point right there where he started in January 2nd, 2017 on the ketogenic diet, and you can see that steep drop in his weight when he started going keto, because he noticed that every time he went off his food plan and ate ribeye, he felt better. He felt better. So he started looking into it, and he found keto, and he started doing this. And then he kept all of his data. So he has currently lost 87 pounds. He no longer uses CPAP. He doesn't use any oxygen. He has increased energy and vitality. He has a 15-year-old son that he has been ill the whole time that this child has been growing up. He's never been able to do anything with him. Now he wrestles with his son. It's completely changed. No longer brain fog. Bowel function improved, decreased pain, decreased edema. Just amazing changes. And even his blood numbers have changed. Interesting, total cholesterol, we know that sometimes that will go up, but triglycerides halved. Still would love to see that down more, but it's halved. HDL is up a little bit. LDL did go up, and we know that happens, and we also know that that happens with insulin resistance and chronic inflammation. His HbA1c wasn't that bad to start with, but it's down even more. And then we look at that ratio between triglycerides and HDL, which is a better indicator of heart problems, and look at that improvement there. 7.49 down to 2.67. So here he was, and here he is now. And he has tried to do exercise as well, but anytime he over-exercised, he would swell. So this is mostly with diet. This is not with a lot of exercise. And here is Georgia. She has lipedema, 71 years old. She was an active gardener and a grandmother, but with her lipedema and the pain issues that she was having, she developed a lot of depression. She wasn't able to do her activities. So she had that grayer weight gain just on her lower body, although you can kind of see a little bit of cuff at her wrist. So we see that it's happening everywhere. And just super fatigued, really tired. She'd take a nap every day, was in the house by 6 p.m. and wouldn't go out. So it reduced her social activity. She had a brain fog, and she said, I was ready for a wheelchair. That's what she was looking at. She figured, I'm old, I'm 71. You're not old at 71. So she started doing keto with me in January of 2017. And she went down to 186 pounds. Within about 3 months, her pain was completely zero, resolved. And we're finding with our lipedema women, it can happen as soon as 2 weeks on keto that the pain can resolve. Her energy level improved. She's now gardening 3 to 4 hours a day, walking on the beach. Brain fog is lifted. She told me that she flew by herself and was able to find the gate to go to, and she never could have done that before. She was so proud of herself. And then her physician was vegetarian and saw all these great responses that were happening, but I'm really concerned you're going to die from a heart attack. Let's do all these tests. She was perfect. Triglycerides were really low. She had a nice HDL. Her coronary artery calcium score was 0. So he's not like he's referring a bunch of patients to me yet, but he has finally said, okay, I guess you can keep eating that way. And there she is. Yeah. So some resources for you, my website, And Dr. Eric Westman and I have both given a online video presentation on the Learn website that you can see right there. We're doing a lot of stuff with lipedema and keto, and you can go to that website. There's a couple of great Facebook groups. I know there's probably more out there, but keto and fasting for lymphedema and keto for lipedema. Check those out. And then I will tell you, I also have over here my books, a KetoCon special, only $10. And if you want to see my program is over here too. Also, I am considering doing a special keto conference specifically on lymphatic disorders and having it in Hawaii. Yes. Who wants to go? Okay, so if you are interested, I have this thing here just to put your name and email address so that I can contact you if we get that going. And I think that's it. There's my contact information. And I think we have a couple minutes, yes?
No, we have to ask questions afterwards.
We're,
Speaker in 5 minutes.
okay, we're done. Sorry very much. Thank you. Thank you.